It's keeping it all on the flat, but we're spreading our wings now.
We have a very good relationship with the Primary Care Trust. One of the reasons we got the money from Sport England and we did this extension was we wanted to encourage a link between health and activity.
This is a cardiac rehab group, so they're all patients that have either had heart attacks, heart surgery, they've been to the hospital to be rehabilitated, and this is what we call phase 4, where they're rehabilitated in the community. I do cardiac rehab at Yeovil Hospital, and someone from here actually contacted the rehab department at the hospital, and I volunteered my services.
I had an operation last June, and now it's February. And, I think I'm fitter than I've been for years.
They're doing cardiovascular exercise. They're programmed to start off with doing 3 minutes on all the CV equipment. We start off with a warm-up and stretches to just prepare the body for the exercise. Then they're doing, like I say, 3 minutes on each piece of cardiovascular equipment.
I went to Yeovil Hospital for rehabilitation, and then that sort of eventually sent us on here. We were doing this at Yeovil until this came into being, so now we can do it on our doorstep, which is much nicer.
I'm my husband's carer, and I can join with him, which means we can do things together, hopefully keeping him fit, because we're both in our 80s now, and we're just trying to keep fit.
We're looking along the lines of Sport England, that we're trying to get people to exercise for 30 minutes or more 5 times a week. So the more activities we can offer, the more likely people are to do it and not get bored with exercising.
We have 2 different projects going at the moment. One is a computerised therapy programme called CCBT, which is basically an 8-week programme for people suffering from depression and anxiety to work on their individual problems. It is a less intense input than actual therapy, but it has proven to be very effective and has received recommendation by various institutions. We also are hoping to run a group on self-esteem and assertiveness and doing some other outreach projects. To be in a place like the Aqua Centre is important because it's easily accessible for people. It's in the community where people are. People feel it's a very friendly venue, feel that it's something they wouldn't feel awkward about going to. It's a much less stigmatised venue than other places where we used to work at.
The close links with the Primary Care Trust came about when, in talks with Sport England, we were looking at funding for the centre. And one of the things that Sport England are very keen on is innovative ways to combine health and sport and activity. So with that, we started talks with our local Primary Care Trust, really by just sort of going and getting phone numbers and names and spending a lot of time like looking around and who's the appropriate person to talk to and how high up is the appropriate person. And after that is actually then finding time to talk to them and actually talk to them and explain to them the benefits of working in partnership, the benefits for them especially, and also the benefits for the community. It takes great courage, I think, for someone to start off doing exercise that hasn't done exercise for a year or so. It's getting people to take that first step, even if they just do something once a week. Once they start doing that for a few weeks, they start to feel better, and then just build it up slowly. Just start off really slowly. And I think the challenge is to let people know this, and that's, I think, the challenge for every leisure provider.
Yes, it's helped. Yeah. Once you get going.